Welcome to the MRO Minute. This is Dr. Schwartz. I'm a medical review officer for Central Drug Testing. This is another episode of the most boring videos on YouTube. This is where we take a short deep dive into questions around drug testing. Today we're looking at the 5-panel urine drug screen, or the DOT drug screen, to help people understand how it is performed, what drugs are tested for, and how long each of those drugs are in your system. For other questions, please see our YouTube page or go to our website, centraldrugtesting.com. So how is a test performed? Whether you're having an observed or unobserved test, the first job of the person doing the collection is to make sure the donor has a federal ID form for donor identification. In an unobserved test, the donor is in the bathroom by themselves providing a urine sample. The bathroom is secured so that no chemicals or cubbyholes can provide contaminants which could be used to substitute or adulterate a specimen. The donor can wash their hands once before testing, but cannot wash their hands or flush the toilet until after the specimen has been collected. Bluing agent is added to the toilet and its tank to prevent this water from being used to contaminate the specimen. Donors are asked to shed outer garments such as coats, jackets, and backpacks, as well as empty their pockets before testing. At this point, the donor goes into the bathroom, provides several ounces of urine in a cup, and provides the urine specimen back to the collection person. In an observed test, there is an observer in the bathroom with the donor to watch them urinate in the cup. These are the 5 classes of drugs tested for in this test. Amphetamines, including these derivatives, are in your urine up to 6 days, but generally only 1 to 3. Cocaine is in your urine for 3 to 4 days. With marijuana, they test specifically for the THC acid. Since it's a fat-soluble drug, it can stay in your system for up to 30 days, depending upon how often you use it. With opioids, all 7 of these drugs are tested for. They can stay in your urine up to 4 days after being used. Phencyclidine is PCP, or angel dust. It too is a fat-soluble drug, and so depending upon how often you use it, it can stay in your system up to 17 days. Depending upon what state you live in, the company doing the testing may be required to use a medical review officer. A medical review officer is a physician who uses their license to look at medical explanations for a positive drug screen. A phone call from a medical review officer is a short interview to see if there's an explanation for the positive test. Prescriptions and certain foods are the most common reason for a positive lab test that can be changed by the MRO to a negative. Many times both the lab report and the medical review office report are provided back to the company. If the state does not require a medical review officer, then the company is just provided with the positive result. That's it for today. Let me know if you have any requests. Please comment below or contact us at centraldrugtesting.com. See you soon.